Coronavirus cases in Idaho are trending down, but transmission in the community is still very high, much higher than other points throughout the pandemic. The Idaho Board of Health and Welfare had a meeting today to try and understand the way COVID is affecting people here in Idaho. Our Shira Matsuzawa listened in and joins us with what they talked about. Shira.
Well, Morgan, healthcare leaders say the hospitals are still feeling the pressure from COVID, even though crisis standards of care was just deactivated this week. They say they're still on the brink.
The hospitals are still experiencing stress. And while their census may be down a little bit, they still are having some stress because their own staff are out sick. And we are, I think, still on the tipping towards the fragile side in terms of hospital capacity, but they are saying to us we don't have the need to operate in crisis standards of care.
Health leaders add there are slightly more fully vaccinated people in the hospital with COVID-19 than before, but this is only a very small difference. Previously, 10% of those fully vaccinated were in the hospital. Now that number is closer to 15%. Health leaders say the vaccines continue to be effective and save lives.
People who are vaccinated are nearly 4 times less likely to be hospitalized for COVID if they become infected.
Now, ivermectin was also asked about during today's call. State epidemiologist Dr. Christine Hahn says ivermectin is not on the list of medications they're trying to implement because it's not authorized by the FDA. And when it comes to monoclonal antibodies and therapeutics, Dr. Hahn says here in Idaho, the state is getting an allocation of about 200 to 350 doses of Evusheld every week, which is not a lot. She says this is being used to prevent COVID for those who may be immunocompromised or can't get the vaccine. And it's available at least one provider in the 7 health districts, but they're trying to expand this. There are also 2 monoclonal antibodies in Idaho being used to treat COVID, and those are sotrovimab, which we've had for several months, and now this week, bebtelovimab has also been added to the list of therapeutics Idaho can allocate. The challenge, though, here is these medications require IVs, and not every clinic has IVs. There are also 2 oral antiviral medications from Pfizer and Merck, which Dr. Hahn said is available at least one pharmacy in each of those public health districts, and those have only been available for a few weeks. Now, there's also an HHS site where you can locate some of these therapeutics, and we'll have a link to those at ktvb.com.